Someone was telling me, Gwen, I am ill, I'm feeling malaise. So I went to the clinic and I went to the hospital and a WIDAL test was done on me. And after 4 hours, the results came out and the results confirmed that I have typhoid and I have typhoid plus plus plus. And in my mind, as a medical professional, I'm like, seriously? WIDAL test for typhoid is not accurate. And I'm going to tell you why. If you're just joining this channel, don't forget to like, share, and subscribe and turn on the notification bell. And if you're a returning subscriber, this is me telling you, I love you. Let's go there. Welcome back to my channel. In today's class, I'm going to be teaching you that WIDAL test is not reliable. WIDAL test done for typhoid is not reliable, it's not accurate. Now, looking at the story that I've just told you, in many clinics around the world, they use WIDAL test to test for typhoid. Now, the WIDAL test is used to actually search for the O and the H antibodies in the blood of the patient. Now, why is it not accurate? Because these tests cannot distinguish between a previous infection of typhoid, a current infection of typhoid, or if the person has been vaccinated against typhoid. So that is the limitation with this WIDAL test. So if you go to any clinic and they tell you have typhoid and they do a WIDAL test and it's positive, you may not likely have typhoid. This test is unable to distinguish between a positive and a negative result. That means it gives false results to patients. So the correct and accurate test that's supposed to be done for typhoid is a blood culture, a stool culture, and a urine culture, and the results are normally out after 48 hours. So during that time when you are complaining or thinking that you have typhoid, you may not be having typhoid, because someone who is having typhoid cannot even take themselves to the hospital. The symptoms of someone who has typhoid are abdominal pain, sometimes constipation, sometimes diarrhea, vomiting, high fever, malaise, in short, rashes all over the body, and a lot more. So this is what you should expect. So don't think that anytime you have an abdominal pain or running stomach or constipation, you have typhoid. And when you go to a clinic, make sure that these tests I have mentioned are done on you to confirm that you have typhoid. A WIDAL test is not reliable, it's not accurate, and I gave you the reasons why. Please carry knowledge as you move around, because when you go into different clinics, into different areas, they will take advantage of your ignorance. And these are stuff you have to pay for. You are going to pay for this test, but it's not accurate for testing for typhoid. So please, when you go, make sure that this test is done. I have mentioned are done. Wait for your results and you will be treated accurately and you will be in good health. So do stay abreast. Do stay close to this channel. If you have any questions in regarding typhoid, do let me know. Only after this typhoid test has been done, this blood culture, stool culture, and urine culture has been done, then an antibiogram will be done. Typhoid is caused by the bacteria Salmonella. Salmonella is a very strange species of bacteria. And when it attacks you, you really can tell you have Salmonella, if you know what I mean. So when this antibiogram will be done, that means it will be tested and you will know which antibiotic is sensitive. And then you will be prescribed an antibiotic to eradicate this Salmonella from your blood system. But please, Whenever you have a headache or stomach ache, or you have chills, or you feel malaise, or you are constipated, or you have a running stomach, please don't go saying you have typhoid. Trust me, running stomach, like I mentioned before, could be a symptom of many other diseases. Constipation, the same thing. So please make sure you get tested. Till next time, thanks for joining me into this class. I remain your seasoned and certified medical professional, Gwendolyn Halle. Bye-bye.